Hello everyone. Today we are in the third part of our discussion, that is on hypoglycemia in diabetes mellitus. We should know the term pharmacologic hypoglycemia. So this pharmacologic hypoglycemia is a condition and which arises due to use of certain medications, and these medications are insulin reactions, use of insulin, and due to this the development of reactions like hypoglycemia. Use of factitious insulin injections means use of insulin analogs, which are artificial insulins. Apart from that, hypoglycemia can develop after use of certain medications like sulfonylureas, ETHANOL, beta blockers, and due to use of some other medications for some other diseases like quinine, chloroquine, and quinolones. Let's see the term iatrogenic hypoglycemia. So iatrogenic means the condition which is developing after any medical intervention or treatment or during any diagnostic procedure. So iatrogenic hypoglycemia means the hypoglycemia which is developing due to any medical treatment. So in this condition of diabetes, the hypoglycemia is one of the recognized side effects of some of the medications used for treatment of diabetes. Those medications are sulfonylureas, insulin. So in this diabetes, the iatrogenic hypoglycemia means the hypoglycemia which is arising due to use of medications like sulfonylureas and insulin. In sulfonylurea, the person who are on treatment with sulfonylureas, the hypoglycemia is the most common side effect, and this side effect gives a major problem when the person is using concomitantly insulin also. And we should also know that insulin also causes the hypoglycemia like condition, but this hypoglycemia like condition with use of insulin is decreased or less in the insulin which are peakless, means the action of insulin has no any peaks in its mechanism of action. So let's discuss the hypoglycemia with oral hypoglycemic agents. So we know that oral hypoglycemic agents are used for the treatment of type 2 diabetes mellitus, and we have already studied about the nocturnal hypoglycemia, which is hypoglycemia which develops at the night and due to use of insulin and some oral hypoglycemic agents. So what are the oral hypoglycemic agents which when used for treatment of diabetes can cause hypoglycemia like conditions? So those are sulfonylureas, MEGLITINIDES, METFORMIN, and ALPHA-GLUCOSIDASE inhibitor. Let's discuss the condition of hypoglycemia with sulfonylureas drugs. So what is the mechanism of action of this drug? So these drugs stimulate the insulin secretion, and this insulin secretion is takes care at any blood glucose concentration. So as the mechanism of action of this drug is that this sulfonylureas can stimulate the insulin production secretion at any glucose concentration. So that is the reason why the hypoglycemia is the most common side effect of this drug, and this hypoglycemia like condition is very common when there is a overdosing of these drugs. And this hypoglycemia due to the sulfonylureas may persist for hours, and because of that the person is required to be hospitalized. This risk of hypoglycemia is higher with the long-acting sulfonylureas as usual. So out of these sulfonylureas drugs, glibenclamide and chlorpropamide are with long half-lives. So because of these long half-lives characteristics, these drugs can be given once in a day basis. And as we have already discussed that the longer acting sulfonylureas have higher chance of developing the hypoglycemia. So the risk of hypoglycemia is higher with these two drugs, glibenclamide and chlorpropamide. However, the drugs with short half-lives like tolazomide and glipizide, they are having with lower incidence of hypoglycemia. Apart from that, the risk of hypoglycemia with sulfonylureas is higher in elderly person, and these sulfonylureas are contraindicated in certain patients, those who are having any kind of renal or hepatic impairment. Why? Because the risk of hypoglycemia is much more in the person with such impairments. Let's discuss the condition of hypoglycemia in other class of drugs which are meglitinides. So the mechanism of action of meglitinides are similar as with sulfonylureas, means these drugs also stimulate the insulin secretion. So these drugs have also similar clinical efficacy as sulfonylureas, and the hypoglycemia is the most common side effect of one of the drug of this class, that is ripaglitide. But as compared to the sulfonylureas, the intensity and the frequency of hypoglycemia with this class of drugs is lesser, means the hypoglycemia in sulfonylureas are with higher intensity and frequency as compared to meglitinides, and this meglitinide drugs has short duration of action and this has rapid excretion. So because of these properties, these drugs can be tolerated better by any person as compared to sulfonylureas, and that's why any person with renal failure can better tolerate this class of drugs which are meglitinides. Let's discuss the condition of hypoglycemia in other class of drugs which are metformins. So this metformin has different mechanism of action as compared to sulfonylureas and meglitinide, which are insulin secretive drugs. So this metformin has no any direct effect on insulin secretion, and these drugs reduce the blood sugar by two mechanism. First one is by decreasing the hepatic glucose production, and second one is the increased peripheral glucose uptake, means glucose utilization by the skeletal muscles. So when we are giving this medication singly, means when there is monotherapy, so the risk of hypoglycemia is very less with this class of drugs. And as compared to other drugs, this class of drugs are much more safer in respect of the hypoglycemia, and the hypoglycemia risk is much lower than other drugs. But hypoglycemia can develop with this class of drugs when the person is doing any severe physical activity or person is in fasting state. Also, the risk of hypoglycemia increases when any person consumes metformin along with the sulfonylureas or insulin, which we have already seen that these drugs are most common to produce hypoglycemia like condition. So when we are giving such medication with such kind of drugs, the risk of hypoglycemia usually increases. So there are some other class of drugs which are known as alpha-glucosidase inhibitor, and the mechanism of action of these drugs are by inhibiting the press border enzymes which are usually involved in breakdown of carbohydrates, and this breakdown of carbohydrate produce glucose. And these drugs, apart from that, also prevents the absorption of glucose after the meal. Usually these drugs do not produce hypoglycemia, but when we are giving some other drugs in combination with these drugs, so in that condition the risk of hypoglycemia is also increases. And whenever there is hypoglycemia with these drugs, so the oral ingestion of carbohydrate doesn't recover the person from hypoglycemia. In this condition, the person is required to intake the pure glucose to recover from the hypoglycemia in such medications. Now let's discuss the hypoglycemia in ethanol like drugs. So in these drugs, the mortality rate is very high, that is approx 10%, and this ethanol produces the severe hypoglycemia that the glucose level can reach up to 10 mg per deciliter and even less than 10 mg per deciliter also. And there are two predisposing factors to produce hypoglycemia in ethanol. If there is already depletion of hepatic glycogen stores in liver is present, or if any person was in fasting state prior to consumption of this ethanol or prior to consumption of this alcohol, in such condition the risk of hypoglycemia increases. So what are the treatment for this? So in this condition we need to give the person intravenous infusion of glucose, and also we need to add the vitamin B1 to that glucose infusion. Now let's discuss the hypoglycemia with beta blocking agents. Propanol and some other beta blocking agents, they sometimes cause hypoglycemia which is symptomatic, or sometimes the hypoglycemia like condition is produced, but the symptoms of this hypoglycemia are masked by these beta blocking agents. There are certain conditions in which the hypoglycemia is very common with the beta blocking agents. These conditions are if the person is in chronic malnutrition like condition, if the person consumes ethanol or alcohol before or during consumption of the beta blocking agent, or the person does some strenuous exercise. So the mechanism of the hypoglycemia which the beta blockers produce are usually unclear, but it has been found that there is inhibition of hepatic gluconeogenesis due to these beta blockers, means there is no production of glucose from fat and proteinous substances, which is known as gluconeogenesis. So in such condition the glucose will not be produced in liver, and then there will be a decrease in blood sugar level. Apart from that, it has been found that this beta blocker also inhibit the autonomic symptoms of hypoglycemia. So in that condition the person will not feel or not be aware about his condition of his hypoglycemia. Now let's discuss the condition of hypoglycemia with insulin therapy. So insulin preparation, the insulin availability have undergone significant innovations over the last several years, and the insulin preparations which are available nowadays are found to be very effective. They are very accessible, and as well as they are very safer. But it has been found that due to excessive insulin, hyperinsulinemic hypoglycemia is also noticed due to excessive insulin injection, and due to which the blood glucose falls below its normal value. and definitely such condition is a prominent obstacles for the safe control of diabetes by the insulin. There are some predisposing factors to cause hypoglycemia when any person is on insulin therapy. So these predisposing factors have been divided broadly into two categories. The first category, when there is increase in the sensitivity of the insulin, and the second category, when there is inadequate carbohydrate intake. So these are some conditions when there is increase in sensitivity of insulin in that person, which ultimately leads to hypoglycemia. And these are some conditions when there is inadequate intake of carbohydrate in such person, and which also ultimately lead to hypoglycemia like condition. Apart from that, there are few other conditions which also may aggravate the hypoglycemia like condition when person is on insulin therapy. Those are exercise. So in this again two conditions are there. In acute condition, when there is increased or accelerated absorption of the insulin which we are giving to the person. Second one is the inadequate repletion of muscle glycogen in the person. The second category is alcohol ingestion, and this alcohol ingestion will definitely inhibit the hepatic glucose production. And the third condition is some drugs, and these drugs are salicylate and sulfonamides, which enhance the sulfonylureas action. Definitely this will add on to the hypoglycemia like condition in such person with insulin therapy. There are blockage in counter regulation. Those are non-selective beta blockers, and some will cause release of insulin. Those are pentamidine drugs. Let's discuss what are the common causes to produce insulin hypoglycemia. The first one is insulin errors. So there are two kind of reversal which may cause hypoglycemia. The first one is if there is reversal in morning and evening doses of insulin. If we have changed or reversed the morning dose into evening or evening dose into morning doses. The second one is reversal of short acting and intermediate acting insulin, so which has some different half lives and duration of action. The third is improper timing of insulin in relation to food, means we have not calculated properly the time when the insulin should be given before or after the food. The fourth one is when there is excessive, the dose of insulin has been enhanced by the treating physician or by the support staff, or if there is mix up of unit 40 or unit 100 syringes of insulin. So in this condition there is error in insulin dose which causes the hypoglycemia. The second category, when there is erratic or altered absorption of the insulin which we are giving to the person. If we are giving the injection of this insulin to the person from exercising limbs, so definitely there will be rapid absorption of insulin will take care in such condition, and this will lead to hypoglycemia. And there is when there is unpredictable absorption of the insulin when we are giving this injection of insulin on any hypertrophied injection site. Among these common causes of insulin hypoglycemia, if there takes place the excessive doses of insulin, and this error can maybe by the patient, by the doctor, or can be by the pharmacist. If there is mismatch or poor matching in the need of the patients for insulin, or when the doses of insulin are not matching with the lifestyle of the patient. The third condition, when there is overdose of insulin, that is deliberately, it is known as factitious hypoglycemia. There is some other condition when hypoglycemia is produced, and this is due to the increased bioavailability of the insulin, and this can be happen due to the person who exercises, or the increased absorption of insulin takes place due to injection at hypertrophied site. Apart from that, the bioavailability can also be increased due to the some presence of some insulin antibodies which release the bound insulin. If person is having renal failure, so in such condition the release of insulin or insulin clearance from the body will takes place longer time, which is sufficient to produce hypoglycemia. And also one condition is there which is known as honeymoon period, when there is partial beta cell recovery. Now let's have some discussion about the classification of insulin. So insulin can broadly divided into three categories: the long acting insulin, the intermediate acting insulin, and the short acting insulin. And this classification of insulin has been done according to their duration of action. Now first discuss with long acting insulin. The common preparation of this long acting insulin are insulin glargine and insulin detamir, and this insulin glargine has duration of action of 24 hours. The detamir has duration of action of 60 to 20 hours, and this long acting insulin are also known as basal insulin, as these provide a relatively low level of insulin for a long period of time. So because of that, the risk of hypoglycemia with this long acting insulin is very low, as there is absence of peaks while during the action of such insulin. The second class of insulin are intermediate acting insulin, as the duration of action of such insulin are less as compared to the long acting insulin, and this has 10 to 16 hours of duration of action, and which are less as compared to long acting insulin. And the peaks of action are unpredicted, and these are the insulin which have higher risk of development of nocturnal hypoglycemia. Because of such properties, such intermediate acting insulin are not recommended during the bedtime. The third category of insulin are short acting insulin, and as the name suggests, this rapid acting or short acting insulin preparations, they function as bolus insulin, and this provide a higher level of insulin, and that is very quickly. So the preparation of this short acting insulin, this include insulin aspart, lispro, and glulicin. All the three preparations, lispro, aspart, and glulicin, has onset of action within 15 minutes, and the action of this insulin lasts for 5 hours duration, and the risk of hypoglycemia is less when such insulin are used just before the meals as a bolus insulin form. But when this short acting insulin are used in hospitalized patient as a intensive insulin therapy, so the risk of hypoglycemia increases in such condition. Now let's discuss the morbidity due to the hypoglycemia. So the hypoglycemia the morbidity of hypoglycemia can be divided broadly into 5 categories: the neurological, psychological, cardiovascular or cerebrovascular, the eye morbidities, and the musculoskeletal morbidities. So the neurological morbidity include coma, convulsions, and etc. The psychological morbidity can be cognitive dysfunction, behavior or personality changes, and others. The cerebrovascular or cardiovascular can include arrhythmia, myocardial ischemia, stroke. The eye morbidity can be vitreous hemorrhage, and the musculoskeletal can be fractures during the convulsions and some other accidental injuries. Now let's discuss the management of this hypoglycemia-like condition. So if any insulin or any anti-diabetic drug is causing the hypoglycemia, so in such condition either we need to replace those medications or we need to adjust the dose of such medication due to which the hypoglycemia is produced. The second one is if any person is having recurrent hypoglycemia, in such condition also we need to evaluate the treatment schedule of the person and revise the dose or medication of those persons. In third step we can revise the glycemic targets and we can set a appropriate glycemic target for the such persons. And apart from that we can also take some other preventive measures to further prevent the hypoglycemia like conditions. Now let's discuss the prevention of hypoglycemia. So in the condition of hypoglycemia, the first step, the important step is the early recognition of the hypoglycemia like condition by its sign and symptoms. And in the hypoglycemia, the iatrogenic hypoglycemia is a sufficient barrier. So for that we need to scrutinize the medication, the type of medication, its dose, its time of consumption or injection to be scrutinized. And apart from that we need to frequently or regularly monitor the blood glucose level in the person which are on higher risk of hypoglycemia. If any person is using more than one type of insulin, in such condition the person should be educated about the order of administration of the such insulin, when and what dose and what time the insulin to be taken. If any person is on rapid acting insulin, so in such condition the blood glucose level should be monitored 1 or 2 hours after the injection of such rapid acting insulin, so that the condition of hypoglycemia can be better prevented. Apart from this, there are some other preventive measures for the hypoglycemia. So in that we need to maintain the regularity in respect of the diet, respect of medications, in respect of exercise schedule of the person with diabetes. The person is advised to take the meals and bedtime snacks to prevent hypoglycemia and as well as the nocturnal hypoglycemia. Person should always carry the sugar or candy along with them as the hypoglycemic emergency can take place anytime. If person is at home, the glucagon should always be available at home so that the instant treatment can be given. The person with diabetes and relatives can be educated about the signs and symptoms of hypoglycemia so that it can be recognized early and can be prevented on time. The person should always carry an identification card which must include the details about the morbidity and disease, the treatment schedules, the address, etc. There are some general measures for preventing the hypoglycemia. So the glycemic target must be individualized. The level of glucose should be set for each and every individual. The patient must be educated about his condition. The frequent self-monitoring of blood glucose must be aware. Exercise management is a very important step in this. What duration of exercise is recommended, what time exercise is recommended, what diet should be consumed before the exercise. Bedtime snacks should also be advised with the person with high risk of nocturnal hypoglycemia. Adequate sleep is very important in diabetic persons to prevent the hypoglycemia, and we need to advise the persons with diabetes that they should avoid the consumption of alcohol before the bedtime. So in acute hypoglycemia like condition, the management tips are: we need to modify the treatment regimen, that is very important, and second one is the correction of blood glucose regimen. Now let's discuss about very important step, that is correction of blood glucose level or hypoglycemia. So in condition of hypoglycemia, pure glucose is the treatment of choice, and if the person is responsive in that condition, we can give oral glucose or sucrose to such persons. And initially, in case of acute hypoglycemic episode, the person can be given approx 15 to 20 grams of glucose. Then we need to check the level of blood glucose after 15 minutes of administration of this glucose, and again if the blood glucose level is less than 70 milligram per deciliter, then we need to give another 15 to 20 gram of glucose to the person. After that, we need to again check the level of blood glucose, and this procedure should be repeated again and again till the time the blood glucose level rises above 70 milligram per deciliter. Once the person achieves this level, the level of 70 milligram per deciliter, after that we will motivate the person to consume a meal or food to prevent the recurrent of such hypoglycemia level, and after that we need to replenish the level of glycogen to such person. Now let's discuss about the algorithm for treating acute hypoglycemia. So for that, initially we need to check the level of consciousness of the patient. If the patient is conscious, so in that condition we need to provide the person the food with any carbohydrate, fruit or any meal, or we can give oral glucose 20 to 30 gram or oral sucrose, and we need to check the level of blood glucose after 15 to 20 minutes, and we need to confirm the recovery. If patient is unconscious, in such condition we need to give him IV glucose 100 ml of 25% solution, or we can give glucagon 1 milligram subcutaneously or intramuscularly, and again we need to confirm the recovery. If person doesn't recover, then again we need to repeat IV 5% or 10% glucose. If in both the condition the person recovers, so in that condition we need to identify the cause for the hypoglycemia. We need to re-educate the patient and the caregivers about the signs and symptoms of hypoglycemia, and to take the appropriate measure to avoid hypoglycemia in future. And there are few cautions we need to take care, that oral glucose gels can be ineffective in such conditions. If glucagon are repeatedly used, so in such condition glucagon may be lost its effect. If the hypoglycemia is due to sulfonylurea, in such condition the glucagon is contraindicated. And The sulfonylureas induced hypoglycemia can be very prolonged, which we have already studied in previous slides. There are some other measures to control the hypoglycemia. If the blood glucose level is less than 54 mg per deciliter, so in that condition glucagon can be given to correct the hypoglycemia. Caregiver must be educated about when and how the glucagon must be administered. In case of severe hypoglycemia, rapid acting glucose solutions should be used for treatment of such hypoglycemia, and 10% IV dextrose or intramuscular glucagon can be given for the treatment of hypoglycemia. Now let's discuss the take home points of this discussion. So low blood glucose or hypoglycemia like condition is very common in diabetes or diabetic patients, and this hypoglycemia interferes with treatment of diabetes, and this can result in serious effects to the patient. For the management of acute episode of hypoglycemia, there are two ways. The first way is correction of the blood glucose level, and the second way is the modification of the treatment regimen. Possibly it is the treatment regimen which is causing the hypoglycemia like condition, and most common are sulfonylureas and insulin injections. The last one, the early recognition of the signs and symptoms of hypoglycemia is very important to prevent such episodes in future and its complications and side effects. So we have come to the end of this presentation. Hope you have liked this video. Please like and share this video with others. Thanks for watching this video.